So this is just a brief overview of what I'm going to be talking about in this presentation today, and I'll leave a little bit of time at the end if anybody's got any questions to ask me. I'd be very happy to answer them. I'm going to talk a little bit about how common loneliness is, first of all, and then talk about the very significant impact of loneliness that we see in our communities. I'm going to spend most of the talk talking about ways that we can help combat and tackle loneliness, so some of the interventions that have been developed, and looking at how effective those interventions are and looking at some of the science and the evidence that underpins those interventions. I'm also going to talk briefly about a case study, a small piece of research that we did here in Sheffield, which I think highlights really nicely what sort of impact we can have on loneliness and social isolation. I just wanted to start off with this quote, first of all, from Mother Teresa, and I think this really nicely encapsulates what a big impact loneliness and social isolation can have on the way that we feel and the way that we live our lives. So I want to just start off with some facts and figures about loneliness and about social isolation, and this comes from some of the research that's been done on social isolation and loneliness. So we know that around 17% of older people are only in contact with their friends, families or neighbours less than once a week. We know that over half of people who are over 75 live alone, and of course living alone can be one of the things that can make us more likely to become lonely. We also know that among people who are widowed or who've had the death of a partner, 63% of that group of people feel lonely some or all of the time. So that's quite a significant proportion of that group of people. When we look at severe loneliness, and what I mean by severe loneliness is people who say that they're lonely all of the time, so there's no sort of respite in that feeling of loneliness. In people aged over 65, we see between 2 and 16% of people saying that they're lonely all of the time. So that's up to 1 in 5, 1 in 6 people over 65 saying they feel lonely all of the time. And I think you'll agree that that's really quite significant and something that, as a society, we really need to be addressing. So we know that there's certain things that can increase somebody's chance of becoming lonely. So we call these risk factors, if you like. As I've said, older people are particularly vulnerable to becoming lonely, unfortunately. There's many reasons behind this, but one of the key reasons is that as we get older, we often retire from our workplace, and that moving out of the workplace can contract our social world, means we're around less people, we have fewer social contacts, and that can be an important reason behind loneliness. We know that people who live alone or spend more time alone are more likely to become lonely. And we know that not being married or being widowed can make us more likely to become lonely. And of course, that goes hand in hand with living alone and being on our own. We know that certain life events, so loss, bereavement, can also increase our chances of becoming lonely. And we know that poor mental and physical health can make us more likely to become lonely. One of the main reasons for that is if we're in poor mental or physical health, it can make mobility very difficult, it can make it very difficult to leave our homes, and obviously that's going to have an impact on our ability to socialise and on our ability to not become lonely. And then the last one, I'm sorry to say, ladies out there, female gender. We know that loneliness is more prevalent amongst ladies than it is amongst men. There's a couple of reasons for this. One of the reasons is that the life expectancy in women is generally a little bit higher than in men. And we also tend to see women marrying or who have partners that are a couple of years older than they are. So we tend to find more older ladies living alone without a spouse than we do see older men in that particular situation. So that's the sort of the main reason behind this gender bias that we see. But you can see all of the reasons that I've put up on the screen there. You can see how all of these can be particularly important for our older population. There are also some things that protect us from loneliness, make us less likely to become loneliness, and it's important to reflect on these as well, I think. People who have a better level of educational achievement are less likely to become lonely. People who have a confidant or a close, confiding relationship with another person are, not surprisingly, less likely to become lonely. And then people who have a greater sense of social connectedness are also less likely to become lonely. And these things I know sound very obvious, but I think it's important that we know what these risk factors and protective factors are so that we can help identify people in our communities who might be the most vulnerable to suffering from loneliness. So, what is the impact of loneliness? Why is it such a big problem, this epidemic of loneliness that we see in our society? Well, obviously, loneliness in itself is not a very nice thing. It's not a very nice feeling. And I'm sure most people in this room, at one time or another in their lives, have at some point felt a bit lonely. I know I certainly have. And it's not a very nice feeling. It's an uncomfortable, subjective feeling of where we are in our society. So it's not a very nice thing in its own right. But we also know, and very striking research evidence is now telling us that loneliness has got a really wide range of other impacts on our health, on our well-being, on our socialisation. It's got really significant range of adverse consequences on our health and well-being. And this is just some of the things that we know are the medical consequences of loneliness. And there's lots more than I could fit on this screen. This is just a selection, but we know that people who are lonely are more likely to be depressed, have cardiovascular disease, will have worse general health, may have impaired cognitive function, a greater number of chronic illnesses, higher blood pressure. It seems astonishing, but loneliness can even affect things like our immune system and can lead to immune stress responses. And we know that people who are lonely are more likely to die and more likely to die younger than people who are not lonely. So we see this increased mortality in people who are lonely. And I think Mark mentioned this in the previous talk, that loneliness can be as detrimental to our health as smoking 15 cigarettes a day. So really quite significant. And of course, loneliness doesn't just have medical effects, it also has a range of social effects as well, and these are just as important as the medical effects. So people who are lonely are more likely to use more tobacco, take less exercise, have worse sleep, and generally have a worse quality of life. We also know that people who are lonely will have a greater average number of nursing home stays than people who are not lonely. And I think for most people that's probably something that they would want to avoid. So a really wide range then of significant adverse health and social consequences to being lonely. But what causes this link then between loneliness and health? This is something that continues to baffle researchers, and we don't yet really have a definitive answer as to how something that's so subjective and intangible as loneliness is, how can that have this huge impact on our health outcomes, on our social outcomes? So as I said, we don't have a definitive answer yet as to how this relationship works between loneliness and poor health and well-being, but we think that it's a very complex relationship, and we think that there are probably a number of factors involved. And this is some of the factors here. We think there's perhaps influences on health behaviours, sleep, vital exhaustion, social connectedness. So it's quite a complicated picture. I suppose that's what I'm saying, and there's work to do certainly in the academic community to try and unpick exactly what this relationship is between loneliness and how it influences our well-being. One thing we do know, and I touched on this earlier, is that older people are particularly vulnerable to suffering from loneliness. And as I said before, that can be down to retirement, but it's also down to the fact that older people tend to have worse physical health and can have restricted mobility. Older people are also potentially facing the death of spouses or partners. And all of these combined effects mean that older people are more vulnerable to loneliness. So this presentation's been a little bit negative thus far. I appreciate telling you how big a problem loneliness is in our society. And I'm going to try and turn it around and talk about some positive things now for the rest of the presentation, and talk about what can we do to address loneliness. How can we combat loneliness within our societies, within our communities? Well, I'm pleased to be able to say that we are taking great strides forward in addressing this problem. And there's a growing national and international recognition now of the importance of addressing loneliness amongst our older population. You can see up here, it's perhaps a bit too small to read at the back, but it's an article published in the Guardian newspaper titled "The Battle Against Loneliness in Older People." And I've seen articles like this in all of the major newspapers over the last few years. I've seen articles in the Telegraph, in the New York Times. And all of this is leading to a growing public awareness of the importance of this issue and a growing public recognition that we need to be doing something to address this problem. We're also seeing some really fantastic work by campaigns and charities, most notably the Campaign to End Loneliness and also Age UK. And both of those charities have done a huge amount of work, both promoting public awareness of this problem, but also trying to come up with some innovative solutions to addressing this problem and coming up with some interventions and different activities that can try and alleviate loneliness in our society. Over on the right here, this is an article from the BBC News website which announced the appointment of a minister for loneliness in the UK. So we now have a dedicated minister whose job it is, part of her job, is to try and address this problem of loneliness, particularly in the older population. So the MP Tracy Crouch has been appointed to that role. And she is largely following in the footsteps of the MP Jo Cox. And I'm sure you remember Jo Cox was the MP who was murdered in her constituency in Batley and Spen in 2016. And Jo Cox was very much an advocate for loneliness and social isolation. She did a lot of work trying to work with Parliament to try and address this issue. And since her death, her work's been continued in the Jo Cox Loneliness Foundation. And they do a lot of work around advocacy and working and lobbying with Parliament. And that, in no small part, has led to this appointment of a minister for loneliness in the UK. So as I said, we're making great steps forward, I think, in addressing this problem of loneliness and social isolation, but we've still got a lot of work to do, and we still perhaps need to think about what can we be doing on the ground, what can we be doing within our communities to try and address this problem. So how do we actually tackle loneliness in our society, in our communities? Well, we've had a really wide range of different activities, different solutions that have been developed over past years to try and alleviate loneliness. I'm calling them interventions, and that sounds a very academic term, I know, but for the purposes of our academic research, we refer to any activity that has the aim of relieving loneliness as an intervention. And these sort of activities, these sort of interventions are really central certainly to government policy, but also central to the activities of charities and campaigns like Age UK and the Campaign to End Loneliness. And this is just some of those activities. I'm sure you'll have heard of these and probably many more. So Age UK run their Men in Sheds programme, which brings together men in a community to learn new skills and meet other like-minded people. Alzheimer's UK run Alzheimer's cafes, so older people who are suffering from dementia can come and meet and have social interactions. Age UK run a number of friendship befriending services, both telephone befriending and face-to-face befriending services. And as I said, there's lots of other different types of activity and intervention that are available with the aim of trying to relieve loneliness amongst older people. But the key question is, do they work? It's all very well putting money and investment and time into developing a programme, an activity, but actually we need to know that it's going to have some effect and it's going to actually help to alleviate loneliness. So we tried to do some work in Sheffield to try and answer this question, and we did a piece of work back in 2016 where we looked across the globe at all of these different interventions that had been developed with the aim of trying to alleviate loneliness in older people. And what we wanted to do was to bring all of that evidence together and look at this body of different interventions and trying to look at what sort of interventions were available, so what's out there in terms of support for older people. Then we wanted to look at the evidence on how effective these interventions were. So was there scientific evaluation underpinning any of these interventions? And then the third thing we wanted to look at was whether we could look across these interventions and try and identify some key features that made them successful. So we wanted to try and identify what is it about an activity or an intervention that makes it successful. So as I said, we did this piece of research. We brought together research findings and information from across the globe, and we came up with as you'll not be surprised to hear, a large number of different interventions that were available in the UK, in Japan, in Australia, run by different charities, different organisations with the aim of trying to alleviate loneliness. And we were able to categorise those different interventions into these 6 different categories. The first type of interventions were those which facilitate social interactions. So these particular interventions had the aim of bringing people together, bringing people out of their homes and allowing them to mix with peers with the idea that friendships are made and social interaction is facilitated. And this was probably the most common category of intervention that we found. So most of the interventions we found probably fell into this category. So that will include things like the Men in Sheds programme or the Alzheimer's Cafe, where people are brought together to perhaps discuss something with a common interest. You might have heard of things like knit and natter groups, where people come together and knit and chat. There's things like book clubs, film clubs. So all of these different types of activity we've called facilitating social interactions. The next category of intervention that we found was what we've called befriending. And befriending is very common in the UK, and over the last few years it's become a much more important way of trying to tackle loneliness. And befriending is a solution that's usually run by a charity, and a volunteer is recruited and trained, and that volunteer is then matched with an older person who's lonely. And the volunteer, the befriender, will go and visit that older person, usually once a week, or they'll telephone them once a week, with the idea that a friendship develops between these two people. And it's a mutual partnership, although it's a volunteer providing the befriending service. The idea is that both people can get some mutual benefit out of it, and a friendship can develop, and this can hopefully help alleviate loneliness. So as I said, that's very popular in the UK, that particular model of reducing loneliness. The third category was psychological therapies. So this involved things like, let me think of some examples, humour therapy or mindfulness therapy or stress reduction therapy. So this category of intervention involved bringing older people together into a group setting, but then there was a trained therapist providing some sort of therapy to the group. And the idea behind this sort of intervention is, rather than trying to increase a person's number of social contacts or trying to give them more friends, the idea is more that you try and help the older person learn to adapt and to cope with their particular circumstances and their situation, with the idea that if they are better adapted and better coping with their personal situation, their personal circumstances, this in itself can help alleviate loneliness. I hope I've explained that okay. The fourth category of intervention was what we've called health and social care provision. So this was similar to befriending, but where befriending usually involves a volunteer befriender, in this category we normally found health and social care professionals taking on additional roles, I suppose, in addition to their health or social care professional role. They were also providing some companionship, providing some listening to an older person, so that their role expands, if you like, to not just look after the person's perhaps physical needs, but also to help with social needs as well. Some examples in that category, we found one intervention that involved student nurses going to visit older people as a sort of befriender. And we also found in nursing homes, the staff in nursing homes being given extra training as to how to provide more companionship and providing listening. Because, of course, people in nursing homes can still be very vulnerable to loneliness, and it's easy for us to think, well, you're surrounded by people in that scenario, but actually people can still feel lonely even when they're surrounded by others. So it's important that we don't forget older people in nursing homes and residential care. The fifth category of intervention was very simple, animals. So we found a number of different pieces of research that looked at whether having an animal, a cat or a dog, could help alleviate loneliness. We even found one research study that looked at whether a robotic dog could help alleviate loneliness. So some really interesting and innovative solutions being proposed. The final category was what we've called leisure or skill development interventions, and this was the sort of thing that would help older people learn a new leisure activity or learn a new skill. So perhaps things like a gardening club, where people could learn new skills in gardening and take that home and find better ways to occupy their time at home. Also things like sports or holiday clubs. We found quite a lot of evidence looking at interventions that taught older people how to use technology. So teaching older people how to use things like Skype or email or social media, and then allowing the older person then to have increased communication with, perhaps their grandchildren who live in New Zealand or other people who they can be in email and contact with that's facilitated by technology. So those were the 6 key categories of different activity that we found that had been developed to try and help reduce loneliness in older people. And the next big question for us was, of course, well, did they work? Did any of these interventions work? And if they did, which worked the best? Well, we found that the evidence which underpins these different interventions was quite variable. And we weren't able to say, well, we've got a winner over here and this intervention is the best and works brilliantly and the others don't work. It wasn't that straightforward. It never is really in research. What we did find was that although the quality of the evidence was quite variable, most of these interventions had at least moderate levels of success in reducing loneliness. And we certainly found that none of them made loneliness any worse, which I think is the most important thing. But most of these interventions, so most of these different activities that I've described, most of them were reasonably successful in reducing loneliness. Even the robotic dog, you might be surprised to hear. One interesting finding that we did come across was that actually solitary interventions can be quite effective. And up until we did this piece of work, the thinking had generally been in the sort of scientific community that in order for an intervention to be able to stop somebody from being lonely, it needs to involve other people. And we need to make sure there's some facilitation of social engagement. But actually we found this not to be the case, and we found that some of those activities, like the robotic dog, like having a cat, like teaching older people how to use technology, these interventions don't necessarily require the older person to leave the home or to meet other people or be in a group setting, but they showed us to be quite effective in relieving that experience of loneliness in older people. And that's a really important finding, I think, because many people in our communities, certainly the oldest old, are not able to leave their own homes. They're not able through physical or mental ill health to be able to get out of the house and be engaged in community groups and be able to come to church or wherever else. So it's very important that for those individuals, we can still do something to help. And even though there might not be a group of people around an older person, we can still help relieve loneliness through some of these solitary interventions. So the final thing we wanted to look at in this piece of research was, what was it across these different interventions that made them successful? Yet we wanted to look across the interventions and find out what it was that made the intervention successful. So what were the common features of the most successful activities that made them successful? And we were able to identify these three key features, which are the things that seem to make interventions successful and the things that certainly need to be borne in mind if people are going towards developing new interventions. So the first thing that we found was that interventions, in order to be successful, had to be adaptable and relevant to a local context or a local setting. I'll give you an example. If we have a community group based here in Sheffield, in central Sheffield, and we invite older men to come together to discuss perhaps the history of the steel industry, that might be a great intervention and work well here in Sheffield. If we transfer that intervention into rural Cumbria, it's not likely to be so successful, partly because of the geographical disparity of people living, but also because perhaps talking about the industrial heritage of the steel industry is not going to be very interesting to a farming community in Cumbria. So it's very important when we are developing interventions that we make sure they're relevant to the local population and they're relevant to the needs of the local context and the local setting. The second thing we found that was important was community engagement. So when people are developing interventions or activities to try and help their communities and to try and reduce loneliness, we really need to be involving that community in those development discussions. And it sounds very obvious, I know, that if you want to develop an intervention to help lonely older people, then you need to ask lonely older people what they want. And it is very straightforward, but I think sometimes, certainly in the research community, we're guilty of not always taking on board the views of the people that we're trying to help. But also, similarly, within this research, we found that the community weren't always involved in the development of interventions, and that was very important to their success. And the final thing that was important was something that we've called productive engagement. And what I mean by that is that we found that interventions that involved doing something or creating something tended to be more successful than interventions that were very passive or just involved listening and sitting. So it seemed to be something quite valuable in the production of something, in being able to create something within a community group or a group setting. And those interventions seem to be more successful than the very passive type group settings. So I'm just going to finish off by telling you about another small piece of research that we did in Sheffield back in 2013 when we were contacted by Age UK Oxfordshire and asked if we could undertake an evaluation of their Oxbell service. And the Oxbell service is a befriending service. I spoke about befriending earlier, and Age UK do a lot of befriending. This particular befriending service was aimed at older people who were at the end of life, so older people with life-limiting illness. And the idea of the befriending service was to alleviate loneliness and social isolation amongst older people at the end of life. The befrienders were all volunteers, and they were trained and supported by Age UK. And the idea was that the befriender would go and spend up to 3 hours a week with the older person, chatting, listening, just providing some sort of companionship. So they had this service running. They'd had this service running for a couple of years, and they wanted to have some robust evaluation of this service so they could try and use that as leverage to get more funding. So we undertook an evaluation of the service. We interviewed 12 of the older people who were using the service, and we used a qualitative data analysis technique. And I won't bore you with the details of the data analysis and the way we went about doing the analysis. I'll just move straight on to the results, because I think they highlight really nicely what sort of an impact these services can have. So we found that this befriending service had really quite a striking impact on the lives of people who were using it. And certainly, as a researcher, I was surprised actually what a big impact it did have. This was a quote taken from one of the interviews, and this lady, you can see, she says, It had a tremendous impact. There's no comparison. Before I had them, I was depressed, lonely, and it's the very knowledge that people care. It's changed my life. Excuse me. And that for me was particularly striking, because what people were saying to us, and it wasn't just this lady, what people were saying to us was that it's not just the 3 hours a week that the befrienders in my home talking to me, they have a pervasive effect throughout my whole life. This lady saying, it's changed my life. So this very simple intervention, just getting somebody to visit once a week for a few hours, can have this sort of impact, and I think that is really striking. We also found that having this befriending service in place could lead to a sense of greater connectedness and greater purpose. And this lady talks about how her befriender taught her how to use an iPad and taught her how to email. So she's obviously got the benefit of having her befriender come to visit her, and she's got a new friend who she sees every week. But also, through the skills that he's taught her, she's able to email. She's able to email him, but she's also able to email her family, her other friends. And that gives her another opportunity for social connectedness. And we also found that the befrienders were often offering quite practical support as well. So this lady saying how her befriender was going to take her to her consultant's appointment at the hospital, and that meant she wouldn't have to use patient transport. This second quote, this lady saying, I think without the befriending service I would have started to become a burden. And she's referring there to a burden on things like social services and the healthcare services. So what we're actually seeing here is that through this relatively simple befriending service, we've not only had a huge impact on the quality of life of the people who are receiving it, but we're also potentially seeing impact in other areas. So we're seeing patients not having to use public patient transport, thereby, saving the NHS some money. We're seeing this lady not potentially becoming burdensome on social services, again, potentially saving the health and social services money. So a really very significant impact. And as I said, as a researcher, I had expected to have a positive impact, but I was surprised at how much of an impact that was and how pervasive it was across these people's lives. So the outcomes of that study really were that befriending does have a very positive outcome, not just for the patient, but actually for their family as well, because their family felt reassured, knowing that there was this befriender who would come to visit. And also, the volunteer gains something from it as well. Don't forget that it's supposed to be a mutually beneficial partnership. And we did indeed find some evidence that the volunteers would also gain something from this relationship as well. Cost effective. We have to, when we're talking about services that are anything to do with the NHS, we have to talk about cost. This is a very cheap service to run from the point of view of Age UK, because it's delivered by a volunteer, and all they need to provide is some training and support for the volunteers. So from that point of view, it's a very cost-effective solution. And certainly since this study was undertaken in 2013, we've seen much more widespread adoption now of this befriending model of activity. And Age UK offer both a telephone befriending service and a face-to-face befriending service now.
So they've taken my phone off me and my tablet and my smartwatch.
It's still early doors, but so far it's been remarkably quiet. I just fell asleep on the sofa in front of the television. When I woke up, I had that instinctive reaction to check my phone, which is just a normal thing to do, and obviously it wasn't there.
It's been a bit lonely, but it's not been unbearable. Being used to living with lots of people as well, it's a big difference.
Usually when I wake up, I check the news apps on my phone to see what's going on in the world, that sort of thing. I think it's not so much about the technology, I've realised, but it's about the feeling of having a connection. I can hear the people in the neighbouring flats heading out in the hallway off to do something a bit more exciting, I imagine. I'm quite jealous of that. I'm starting to find it quite difficult, to be honest. I can't sleep at all. It's almost like I'm not mentally prepared for bed, because there's not been a beginning, middle and end. It's just been a constant nothingness. Morning. So, on the bright side, today's the last day. Just counting down the hours now. And I've just kind of gone into robot mode. If you start overthinking things, you start thinking about how lonely you are. I'm supposed to do these video diaries, but I don't know what to say. Call your mum, I suppose.
Are you Joe?
I am, yes, nice to meet you.
Hello, Joe.
How are you doing?
I'm very well, thank you. Come in.
Thank you very much.
How did you survive?
It's a good question. It was certainly certainly very trying at times, I think. A real sense of being left out and being alone and not being part of it and being very cut off.
It's not something you think about, is it? Until it actually happens to you. And then suddenly you become aware of it and realise the significance of what goes on in the world and how many people are lonely. I was bereaved
Right.
2.5 years ago.
Oh, right.
Not having someone to talk to hug, to share things with. The more elderly people particularly, it's part of life. I can promise you that it can be devastating.
How do you think we can combat it?
The answer to that, probably the key would be to be aware of people. To talk to someone in that situation who is lonely, you have to, it really requires a little effort, doesn't it? I think that's the key. That's the key.
I can tell you about the video. It's called The Loneliness Project, and it's been published by the Campaign to End Loneliness. And it's a very short video clip, but I think it's really nice to watch, and it really emphasises what sort of impact loneliness can have. So I just want to finish by summarising that loneliness is a really major problem. It's an epidemic in our society in terms of its impact on health and well-being, particularly for older people. We do now know that there's lots of different interventions to tackle loneliness, and many of them are very effective. But we need greater awareness, and we need to work harder, really, at identifying the people in our communities who are suffering from loneliness, and then trying to identify the appropriate interventions and activities for those people. As I've said, we have lots of national campaigns and advocacy organisations now, which is making great strides in increasing public awareness and public recognition about this issue. But local organisations, local charities are really crucial as well in this battle against loneliness. And it's only really on the ground within our local communities, within our regional organisations, that we can make sure that our activities and interventions are relevant to our particular populations here that we work with. This is just some links, some useful resources of places to go for information about loneliness and social isolation, and information about some of the interventions that are available. And I'm very happy to share these slides afterwards so that people can have access to them. And that's it, really. Thank you again for inviting me. And I've just been given a note to say that we're asking people to save their questions to the plenary session later on, but I'll be very happy to answer any questions then. Thank you.